The right to health is an inclusion right, extending not only to timely and appropriate health care, but also to the underlying determinations of health such as access to safe and potable water, adequate sanitation, and many others. In September 2015, mental health was included in the United Nations Sustainable Development Goals. In this historic step, the United Nations acknowledged the burden of mental health illnesses and defined mental health as a priority for global development for the next 15 years. Mental health is more than the absence of mental disorders. It is an integral part of our health, and everybody has it. It's not just about our emotional, psychological, and social well-being, but it affects our thoughts, emotions, feelings, and behaviors. In most cases, mental health is associated to stress, depression, anxiety, which leads many to suicide. The gap in talking about mental health has caused untimely deaths in many communities of Eastern Province, where the numbers of suicide of young people has continued to increase. Most of the cases, as disclosed by the Mental Health Unit or Psychiatric Department in some of the sampled hospitals in Eastern Province who have refused to reveal their identities, are related to conflicts, drug abuse, and the use of cannabis. Concerned advocates for mental health have shared their experiences on the stigmatizations and what mental health really is. Also, the impact that the COVID-19 has brought about to the young people within Chipata and Eastern Province at large.
So the reason why people in Chipata have not taken mental health so serious is very simple, because most people have got little knowledge about mental health. They do not have that knowledge. They don't know exactly what mental health is.
I feel it is through stress, anxiety, and worry that COVID-19 affects the mental health of a lot of people. Just starting from the number of deaths recorded, that actually strikes fear in the hearts of a lot of people, especially those who've lost loved ones to COVID-19. And with the misinformation about COVID-19 and the vaccine going on, a lot of people would prefer not going to get tested, because we've seen a number of times where people who test positive end up committing suicide because of the false information, because they're scared, because they are worried. And it is something that the government and basically just stakeholders and everyone should look into, so that we disseminate the correct information about the vaccine and about COVID-19.
Many young people who were interviewed and refused to reveal their identities also refused to say they do not know anything about mental health.
About mental health, I just hear, but I don't know what mental health is.
Ninamvera hapo manje siniza kwene kuti nchani.
Mental health, bwana palibe petiziwapo bwana sevo.
Pali mental health.
They don't know what are the symptoms. Which places can you go to? Where can you take a patient that, for example, is suicidal, a patient that is struggling with depression? Where can you take them? They don't know such kind of things. So that's the more reason why most people, and it's also due to lack of serious awareness. There is little awareness that is being done towards mental health. Due to that, most people, they have no idea about what mental health is.
Statistics prove that during the lockdown period, cases of domestic violence have increased, which have contributed to affecting the mental health of a lot of people, and that is something that we also need to look into.
Then also some of the stigmas towards mental health are that somebody who is struggling with mental health, they are believed to be lazy people. And also mental health itself is believed to be an illness that is only in the Western countries, of which mental health affects everyone. Everyone is affected. It does not choose color. It does not choose the age. Everyone can struggle with the mental health. So that's just it about mental health. And also right now, the period that we are in is a very difficult period, especially that the pandemic which has come. A lot of young people, a lot of people, they are affected mentally due to the pandemic, due to the COVID-19. So you find that a lot of young people who are in schools, today now they are not in schools. Their schools have closed, so that affects them mentally. And also you find that there's pressure here and there, and young people also have like they are learning online nowadays. And I've heard a number of complaints that no, we don't have bundles, we are like in bundles and things like that. So the COVID-19 has affected a lot of things. And also just to talk about young people losing their jobs, losing their contracts. And I appeal to the government to continue sensitizing on mental health, especially in rural areas, losing their contracts. And I appeal people also have
Local advocates are urging societies, churches, schools, and many other stakeholders to play a role in helping reduce these deaths through recreational programs, mental health awareness, and many other possible ways. Looking at the number of deaths being recorded, mostly of youths committing suicide, it is evident that there is need for communities to come together and look at mental health critically, for it is a fundamental human right to health. Reporting for Alliance for Community Action, I'm Misheck Cheleka in Eastern Province.